Over the past few years, I've been dealing with Alzheimer's dementia. It started to be called type 3 diabetes because Alzheimer's dementia is type 1. Like type 2 diabetes, it's carbohydrate. This is because the side effects of central meals have become more and more evident. A long-term comparative study published in the journal Diabetologia, or a 10-year study of 5,189 people. Results show that people with high blood sugar levels suffer from cognitive decline much more quickly. In other words, the higher the blood sugar level, the higher the probability of dementia. Dr. Rosbud Roberts, author of a research paper on 1,000 people published in 2012. People who eat the most carbohydrates have an 80% chance of developing dementia. Dr. Melissa Schilling, a professor at New York University, also conducted a review study in 2016. We found that higher insulin levels led to a higher probability of dementia. Specifically, it was announced that the probability of Alzheimer's dementia is roughly doubled in the case of type 2 diabetes. In fact, it is already known that insulin is directly linked to Alzheimer's dementia. When you eat a carbohydrate-centered diet, insulin comes out and your blood glucose levels go down, play a role in reducing. After the role of insulin is over, it becomes a hypoglycemia that lowers blood sugar. Insulin-degrading enzyme comes out and breaks down insulin. There's another task that insulin secretory enzymes are responsible for. It breaks down a piece of beta-amyloid protein that acts as an indirect cause of dementia. The problem is that insulin-degrading enzymes can't do both things at once. If you have more insulin in your body, you lose the room to break down amyloid properly. The risk of Alzheimer's dementia increases. Therefore, maintaining your insulin levels normally by resolving the insulin resistance problem it can be said to be a decisive factor in preventing diabetes as well as Alzheimer's dementia. But Dr. Schilling also said that people with type 1 diabetes who can't make insulin can't. We found that the probability of Alzheimer's dementia increased equally. How can you make insulin or not make it at all? Is the probability of Alzheimer's dementia going up the same? Dr. Schilling said that in patients who cannot produce insulin, not just insulin, it doesn't make a lot of insulin-degrading enzymes that do the work of dissolving beta-amyloid. Explain that. And if you're using insulin, most of the time, you're using too much luck. To break down excess insulin, the enzyme breaks down protein fragments that build up in the brain. There's no room for things to happen. Of course, the result is Alzheimer's dementia. Dr. Schilling said that this doesn't just happen to diabetics. It can happen to anyone who eats too much carbohydrates without much activity. I'm warning you. Dr. Schilling's next comment is that people who are trying to prevent dementia need to keep that in mind. Alzheimer's is like a tiny fire that starts out invisible. As abnormal substances build up so slowly in the brain, gradually, your memory starts to deteriorate. One day you'll find that there's a problem, and then you can't put out the fire. It's already late. Best for lowering insulin levels if you want to properly prevent dementia. K-quality protein. And it becomes even more evident that it is important to eat non-starch vegetable-oriented meals.